Hello, I'm Dr. Azy, and this is the third lecture in the abdominal aortic aneurysm station. It's a critical care station, and you want to know the questions and the perfect answers or the ideal answers that are acceptable by the examiner. Okay, so we are going to the questions, and actually I will not mention them in order because you will never know the order, but these are the questions. He may put one first and then the other. It depends on his opinion, but actually he has to ask these questions, and he has to give you the marks according to the answers that are with him, which we are going to discuss here. Okay, so first of all, they are going to ask you about the definition of massive transfusion. Okay, what is massive transfusion? What is the meaning of massive transfusion? Massive transfusion is the replacement of the blood volume of the patient in 24 hours. This is one definition. Replacement of the blood volume of the patient in 24 hours. So the adult blood volume is 70 ml per kg. So if he is 70 kgs weight, his blood volume is about 5 liters or 4.9. It is almost 5 liters. So if you give him blood volume of 5 liters during 24 hours, so this is a massive transfusion. This is the first definition. What is the second definition? Okay, the second definition, or you are going to mention like that. It is the replacement of the blood volume of the patient within 24 hours or more than 50% of the patient's blood volume within how long? Or less than 4 hours. Okay, so if he is 70 kgs and his blood volume, total blood volume should be 5 liters. If you give 2.5 liters to this patient within 4 hours or less than 4 hours, this is a massive transfusion. So these are two definitions for the massive blood transfusion. Okay, well, so they are going to ask you, do you know what is the autologous blood transfusion means? Autologous blood transfusion. What is autologous blood transfusion? Okay, autologous blood transfusion is a procedure, okay, by which we reinfuse the patient's blood to him back. We reinfuse. He bled. His blood is out. We take the blood and take it back to him. This is autologous blood transfusion. This is an easy question. Actually, all the questions of blood transfusion are so easy, and sometimes they look stupid. Okay, but they're so easy. But you need to focus and you need to be relaxed to answer these questions. Okay. Well, they're going to ask you about the components. He is going to ask you about, please name me 3 components of blood. So you know that the blood is taken from the donors as whole blood, and then after that it is divided into parts. So the best way to transfuse blood is whole blood. They are getting back now to the old school, but still we are using packed RBCs, we are using cryoprecipitate and so on. So he's going to ask you, tell me 3 components of blood, different components. So packed RBCs is an option for you. Platelets is an option for you. Fresh frozen plasma is an option for you. All these are derived from whole blood. Cryoprecipitate, okay, is another option. Well, what else? It could be these, for example, packed RBCs could be leukodepleted, no WBCs on them, could be radiated and they are packed, or could be whole, as you like. So he wants 3 components. So this is the answer for the question simply. Okay, they are going to ask you what are the complications. This is a long way. You will have a long answer here. What are the complications of blood transfusion? And to divide them, you want to remember that there are immunological and there are non-immunological complications. Okay, we will start with the immunological complications here. So immunological complications are as follows. Number 1, the patient may develop acute hemolytic reaction, ABO, due to ABO incompatibility. So he may develop acute hemolytic reaction, okay, due to ABO incompatibility. Okay, he may develop febrile, something called febrile non-hemolytic reaction. Okay, this is another reaction, okay, or another complication. 3, he may develop anaphylaxis. This is immunological also, right? The patient may develop also what is called graft versus host disease. Okay, so these are 4 immunological complications. We want to add another one. The 5th one is transfusion related acute lung injury, TRLE. Transfusion related acute lung injury. This may lead to acute respiratory distress syndrome and death. Okay, so these are the 5 immunological complications that may occur due to transfusion. Okay, we will go now to the non-immunological complications. Okay, so what are the non-immunological complications? The patient may develop hypothermia if it is cold, if the blood is cold, right? Hypothermia. Okay, this is the first one. Well, what may occur else due to blood transfusion? Patient may develop congestive cardiac failure, right, due to overload. Yes. The patient may develop this due to overload. Okay, he may develop hypocalcemia, right? Why? Because in the packed RBC there is citrate and it will chelate the calcium and cause hypocalcemia. So low calcium will occur. Okay, we'll have low calcium. What else may we get here? If it is cold and there is hypothermia, there may be low oxygenation or hypoxia. As we mentioned before, the curve will shift to the left. So the affinity of hemoglobin to oxygen will increase. So according to that, oxygen will not be released to the tissues. Okay, well, fine. What else may occur? We may have hyperkalemia, high potassium, right? Because the lysed RBCs will release potassium, right? So we may have hyperkalemia. What else we may have? Non-immunological. Let us think again and find something else here. Okay. We may have actually thrombocytopenia, and this is what they call it. So thrombocytopenia is low platelets, right? Thrombocytopenia, you gave too much blood and you did not give platelets. Remember that the patient is bleeding whole blood, right? He's bleeding whole blood, and you are giving packed RBCs, right? So you will give a lot of packed RBCs, but you are not giving platelets or not giving whole blood. So in this way, if you do not give a good percentage of 1 to 1, 1 packed RBCs to 1 platelets to 1 fresh frozen plasma, okay, you will have a problem after a while. Fine. So these are the non-immunological complications in general, okay, 5 also or 6. So you have a good number now. You can mention some of them for the examiner or all of them if you want, okay. That is good. So we are going to the next question here, and the next question will be about give us some indications for platelet transfusion. Okay, some indications. Okay, give us 3 indications. Let's say 3 indications. These are common in the exam. Okay, so if the patient has thrombocytopenia, you want to give platelets, right? If the patient has a consumptive coagulopathy like DIC, for example, consumptive coagulopathy, something that consumes the platelets like DIC, you want to give the platelets. Okay. If the patient has thrombocytopenia, this is low platelet, let us tell post-op, okay? If he has low platelets before, he has sickness, he has disease, he has anything, you want to give also platelets, okay? Especially if you are going to give, going to an invasive procedure, you want to give this before. So you need to be smart, okay? And you are smart already, so just use your capabilities to answer, okay? It is not difficult here. So what is the shelf life? Easy question. What is the shelf life of platelets? Your answer will be 3 days, right? Okay. And you want to tell them that this is on room temperature. Fine. On room temperature, it will be 3 days. Well, let's go to the next question. Oh, this is nice actually. How do you transfuse platelets? How there is special setup for transfusion of platelets. So how to transfuse platelets? So in this case here, you are going to tell that there are some conditions that should be there. Okay. First of all, you want to do that in less than 4 hours of collection. Number 2, or don't take more than 4 hours in transfusion of platelets. Okay. You want to use a rapid short set or cannula. Okay. Number 3, you want to use no filter, because some sets has filters. No filter. Number 4, if you have an adult, you do not want to give more than 6 units. So you give equal or less than 6 units. Okay. And finally, you want to check after 1 hour of transfusion. Okay. So first of all, you want to give in a period of 4 hours or less. You want to use a short rapid set. You want to use no filter. You want to use no more than 6 units, and you want to check the patient after 1 hour. That is the answer required from you in the exam. Okay. So in this case here, they may ask you how are you going to manage the patient. You are going to manage the patient according to the NICE guidelines, according to the care for the critically ill surgical patient, A, B, C, D, E, as you know, and we can see this later, okay? What can we add here more? Actually, we want to stop here because I do not want the lecture to be too long, so I will see you in another session, okay? Thank you very much.